Dr. Moskowitz got his medical degree at New York University School of Medicine and has homeopathic training and experience. He has a general and family practice since 1967 in Massachusetts. Dr. Moskowitz has written several books and numerous articles, so please give a warm welcome to Dr. Moskowitz.
You know, I've been interested in this topic for a long time, vaccines. And when I started to study homeopathy, I began to understand why I always thought it was a little fishy. The concept, I mean. Not just the practice, but the idea. And because homeopathy teaches that a medicine has a totality of effects, an array of symptoms that it produces and that it can cure. Whereas, in order to be considered effective, a vaccine need only satisfy two very limited conditions, namely that it lowers the incidence of the corresponding acute disease by a very significant amount, and two, that it produces specific antibodies circulating in the blood. So there's something, you know, there's a lot left out of that equation. So anyway, I'm just gonna present one little case here, just so you can see what the problem is. The problem is not just that they're dangerous, but that nobody sees the danger of them. And I think it's very clearly illustrated by this case. You'll pardon my use of this dinosaur because I am myself a dinosaur and I haven't learned the mysteries of PowerPoint yet. I'm working on it, but anyway, we're doing it the old way here. This is a kid who was in perfectly good health until the age of 15 months. When he received his normal MMR vaccine. And about a week or two later, he developed this major flu-like illness. And and it just kept persisting and persisting, and finally he started to swell up. And by the time 6 weeks had gone by, he went into the physician and they found a lot of protein in the urine and they diagnosed renal failure. Nephrotic syndrome. And the mother, you know, had just felt instinctively that this was because of the vaccine. So she mentioned that to the pediatrician, but the pediatrician said, no, it's a coincidence. So anyway, to make a long story short, hospitalization after hospitalization followed. He received massive doses of prednisone over a period of time. He missed months and months of school. This went on for about 5 years. At the age of 5, he threw it off. He finally recovered. He was perfectly normal in every respect. And everything was sailing along beautifully until the age of 10, when the policy changed and the doctors instituted an MMR booster. And at this point, his mother was very upset and was very strongly inclined not to do it. But she went to the internet and she tried to find anything she could find about MMR and renal failure. And there was absolutely nothing that she could find. So very reluctantly, against her better judgment, she agreed to the pediatrician's insistence that he receive this, that he was in danger if he didn't receive it. And this time, within a week, he had a huge relapse, worse than it had ever been before, and essentially developed chronic progressive renal failure, which was not responsive to medication. He had massive high blood pressure, massive edema and weight gain, and and as far as I know, that was the end of it, that he was destined to have a kidney transplant at some point. Now, I know of this child only through her mother's letter. I never actually met him. But her words were so heartfelt and they were so congruent with the rest of my experience that I just could not doubt the truth of what she was saying. And so at this point, here's her child crippled for life by the vaccine. She's still trying to validate what she felt all along. So she finally wrote to the manufacturer of the vaccine. And again, very reluctantly, as you can well imagine, they sent her 2 almost identical cases of renal failure following the MMR vaccine. So she brought this into the pediatrician to show it to him. The pediatrician still continued to deny it adamantly and said it was a coincidence. He would not buy into this at all. So that's the problem that I'm presenting to you today. Why is this so difficult to see? I mean, I'm not doubting that the pediatricians who cared for this boy were sincere and they were motivated by every good wish for his health. There are some pediatricians whom I feel do not satisfy that condition necessarily. There is some bad faith about this. There is a lot of instinctive shielding of our worldview from anything that might challenge it. Okay, I know that. But it's more, but with vaccines it's more than that. And the proof of that is that doctors freely volunteer their own children for these experiments. They believe in these vaccines. So, and they seem heedless of the obvious possibility, in fact, the certainty that to the extent that they do what we want them to do, if they really have the power that we expect of them, then they also have the power to do a lot of other things. And it's almost certain that a large population of susceptible individuals are going to be adversely affected by these things. But somehow that doesn't get a lot of credence. So that's my problem for today. Why is that? Now, in my past writings, I've referred to it as a religion, as the vaccines are like a sacrament of modern medicine, and we're not supposed to question them. This is the editor of The Lancet, a very prestigious British medical journal, who had the temerity to publish an article in the 1970s that claimed that the MMR was associated with autism, and he actually was a gastroenterologist, and I will talk about his work later. But anyway, when he published this article, which, by the way, he didn't even agree with, he didn't share the conclusions of the author. He thought that it was very questionable, but he was willing to publish it because the guy was a very well-known gastroenterologist. He was very prominent in British medical circles, and he saw nothing wrong with the study. And so he was pilloried for that. He was shunned by his colleagues and stuff. And of course, that was nothing compared to what happened to the author of the study. He was actually terminated from his teaching position at a prominent London hospital. And now he's continuing to do his research offshore near the United States, somewhere in the Caribbean, I believe. I'm not sure exactly where. So there's an almost religious feeling that surrounds these agents, that we give them a very special consideration that we don't give to any other drug. Because drugs are known to have side effects. We don't question that. We have long lists of what they are, and we publish that. I mean, But with vaccines, they get a free pass, it seems like. And I've noticed that the vaccine establishment, so to speak, never seems to meet a vaccine that they don't like. Whatever it is. It's like it has become like a panacea for everything that's wrong with the healthcare system. If you can find a vaccine for it, fine. Why not give it a shot? So it's a kind of a sacred cow, you might say. And indeed, can you see that? Not very well. Well, that's as good as I can get it, I'm afraid. But anyway, you should. There's a handout with this on it, so you can get it from the website, I believe. But anyway, the point of this slide is just to show what are the officially sanctioned side effects of the vaccines. And if you look at it closely, you'll see that they're one-time catastrophic events that happen almost immediately after the vaccine is administered. Within 24 hours, within a couple of days, at the most within a week. There's one thing, in the case of the polio vaccine, oral paralytic polio, they'll give it 30 days because that's so obvious. But immediately what's ruled out of this is, first of all, anything that's chronic, anything that's self-sustaining, anything that's an actual illness rather than a catastrophic accident or an injury, like anaphylaxis, for example. So the guidelines are extremely limited. So part of the problem I've discovered is that what we're looking for, the things that we think about, are specific effects of specific vaccines. So we're looking for a smoking gun. We're looking, and the anti-vaccination people are also looking for this. Mercury, or the MMR in autism, or DPT encephalopathy. We're looking for some definite thing that happens from a specific vaccine over and over again, not just something rare and very unusual, like what happened to this poor kid. Okay? By the way, I don't know what actually happened to that kid. That was almost 20 years ago now, and I recently tried to locate the mother. I Googled her, and I found her address, and I wrote her a letter, but she never answered it. So that suggests to me that perhaps he died or had a kidney transplant or something, and all she was doing by writing to me was she wanted somebody to validate her experience. She wasn't asking for homeopathic treatment. She lived 1,000 miles away. She just wanted somebody to tell her that she wasn't crazy. So I told her that she wasn't crazy. Okay, so I'm going to take... Oh, here's one I can't resist showing you. Part of the religious aspect of vaccines is that you will almost never find an article in a newspaper that reports that someone was actually harmed by a vaccine. The closest you will ever get to that is, some kooky parent will report it, or some official establishment doctor will refute it. But an actual news report you almost never see. But in this case, you did see it. It sneaked out for just one day when then Defense Secretary Les Aspin was traveling to Europe, and he got some routine vaccinations and immediately developed congestive heart failure, which he had anyway. So it was an exaggeration of his pre-existing condition. And so there it was, right on the front page of the Boston Globe. And the following several days, the story continued. It remained newsworthy, but there was no further mention of the vaccine part. So it just squirted out that one little time. Okay, so the first, I'm just going to do this very quickly, but the first example of a supposedly specific effect was DPT encephalopathy. That was big stuff in the 1980s. This was a letter that I got from a mother in Canada whose kid was clearly damaged by a DPT vaccine. She had videos of before and after, and the kid's eyes are glazed over. It's a dramatic thing, and she was suing. She wanted a letter of support for her position that the vaccine injured the child. And of course, I didn't know for sure, but I did write her a letter in support saying that it seemed very plausible to me, quite likely, that that was the reason. And interestingly enough, the pediatricians diagnosed her as being autistic, a point which I'll return to later, because it turns out that these terms are very generic. Encephalopathy itself is a very generic term. It just means brain damage. And it's clear to me that autism is another form of brain damage, and it's equally nonspecific. It's all over the map. It's a wastebasket for whatever we don't know. So, in other words, what I'm getting at is that encephalopathy and autism are not specific effects. They're very broad, general effects. But never mind. The point is that even these, even though, here's another one from a lawyer who is representing a brain-damaged child, and this is another common pattern where the child was given the first DPT, did poorly, started falling behind developmentally, but then he recovered, and then he went into a nosedive after the second one. It was a warning unheeded. This happens over and over again. Because again, we believe in vaccines so strongly that even a red flag like that is ignored. The kid went through a nosedive for months. Finally, he recovered, and so they gave him another one, and he has never recovered from it. And so there were thousands and thousands of lawsuits that were brought during the 1980s because of DPT encephalopathy, and there were many, many awards, giant damage awards from the courts. So Congress finally stepped in, and the outcry was intense. So Congress finally passed an act in 1986 that created a vaccine adverse events reporting system for all vaccines, set up quasi-judicial hearings for them to be adjudicated, and the federal government took on the responsibility of paying off these various claims. And of course, as you might expect, the result of those was that the number of awards dropped precipitously. They were heavily stacked against the patients. So, and meanwhile, there's been some work done to try to develop an acellular pertussis vaccine that would be less injurious, and to a certain extent that has proved true, but not so much. What has really happened is that the doctors went on the offensive and tried to deny that even this was a bona fide phenomenon. Again, the doctors claimed, and still claim, that this is a coincidence. It's time to recognize it as the myth that it is. Here, the punchline is, let's see if I can find that. It's late in the 20th century, and it's time for the myth of DPT encephalopathy to end. And essentially, it has ended in the sense that it's on the back burner now. Nobody pays any attention to it, but these cases are still happening. It's just that they're less likely to win an award now because it's stacked against the patient. And there's another aspect to this story too. Got too many slides here. Here was another fascinating thing that, again, remained invisible in the United States. Dr. Scheibner, an Australian scientist, was studying SIDS, or cot death, as they call it in Australia. And her husband is an engineer, so they designed this breathing monitor that could be read from an adjoining room. And of course, nowadays, these things have been developed even more. And, you know, my son just got one for his baby daughter. So anyway, they found from just routine use of these machines that babies have apneic episodes lasting several seconds, just randomly throughout the day, and they would be increased in the case of a cold or teething or some such thing. And what was most interesting to them and unlooked for, really, because they had no idea that vaccines were an issue of any kind, was that immediately after the DPT vaccine, these apneic episodes became much more frequent, much more intense, sometimes required resuscitation. So they brought these tracings to the local pediatrician and didn't tell him what was happening, and just showed him the tracings, and he pointed to that place and said, "This is the cause." And then he pointed to the drop, and he said, "This is the effect." And then they told him what had happened at that time, that it was a DPT vaccine, and he said, "No, no, no, impossible," and just turned his back on the entire thing. So the Australian pediatric establishment turned their back on this research completely, refused to accept it. It has never even been mentioned in the United States in any medical journal whatsoever. But interestingly enough, there was a study by the Tennessee Health Department a few years before this that indicated that there was a remarkable coincidence between the incidence of SIDS and the use of the DPT vaccine. Wait, I'm ahead of myself here. But it's interesting that a lot of countries stopped mandatory DPT vaccinating after that, or before that in some cases. And the one big evidence comes from Japan, where they stopped the DPT vaccine until the child was 2 years of age, and SIDS essentially dropped off the map. There was no SIDS to speak of. And this was actually reported by James Cherry and the Pertussis Task Force. James Cherry is one of the leading pro-vaccine advocates. So you would think that knowing that would have induced the American pediatric establishment to do something similar. But no, nothing of the kind. They didn't draw that conclusion. And it turns out that, you know, from that data, you would anticipate that SIDS is peculiar mainly because of the time frame. In other words, it happens primarily in children under 1 year of age. And after that, the danger is not there. And so it turns out that there's a Hep B case of SIDS also, which I'll show you in a moment. So there's nothing specific about SIDS either. It turns out that is a response that's already there, that kids already are having these apneic episodes, and the vaccine in some cases simply makes it worse. Okay. So now the MMR and the autism, similar thing. We've already seen the autism case from the DPT. But then the next thing that happened was the Lancet started publishing these articles. And the first one was a very interesting study by this gastroenterologist and a colleague in the United States, which showed that children who had been vaccinated with the MMR were much more likely to develop inflammatory bowel disease later in life. Crohn's disease, ulcerative colitis, and these were by large factors. I think, let's see, it was, what was it? Well, it was twice the incidence in one and 3 times the incidence in the other. So Dr. Wakefield, who was the lead author of this study, began to study children who had been vaccinated with the MMR. And what he found was most interesting. First, quite a lot of them, a much larger percentage than in the ones who were not vaccinated, were autistic. And secondly, much to his surprise, a lot of them had gastroenterological disease. They had microscopic lesions in their intestine frequently that were indistinguishable from inflammatory bowel disease later in life. Furthermore, they showed measles antibodies in those lesions. So that was the article that the Lancet published that got that editor and the author into so much trouble. In fact, recently, that article has been officially retracted by the Lancet. They decided that they didn't like it anymore, and they repudiated it. I'm sure that Richard Horton was not the editor at the time that it was repudiated. And then it turns out that these findings were replicated in Japan and elsewhere. And in the UK, a similar link was found because the MMR was introduced quite a bit later. And the peak in autism corresponded almost exactly to that time lag. So there have been a number of studies that seem to go along with that correlation. So meanwhile, the incidence of autism has skyrocketed, as you all know, to the point that even the CDC, who had been among the sort of Holocaust deniers of this field, they yield to no one in their enthusiasm for vaccines, has estimated that the incidence of autism is now about 1% of all 8-year-old children have signs of autism spectrum disease, according to the CDC. And the true figures may well be higher than that. And study after study has shown that there's no correlation whatsoever between the MMR and autism. These are official studies, and I'm not even impugning them because what we consider to be a cause in medicine is precisely the problem. Because we really get that from the drug industry, basically. What we think of as a cause is something which forces something to happen that has no natural inclination to happen. That's the way the drugs are developed, that we want a drug that's going to force the blood pressure down or going to force the cholesterol down. We're not interested in the sensitivity of the patient. In fact, we use the placebo-type experiment to control against that. So if the drug can't override the sensitivity of the individual patient, then it's not any good. And so things that involve the sensitivity of the patient, a predisposition to react in a certain way, those things are on the placebo side of the equation by definition. That's why what homeopaths do, for example, always comes out as an anecdote. It doesn't compute as a cause because it's not forcible. It doesn't override those sensitivities. It uses them. It makes use of them. So anyway, but my point is that autism is simply another kind of encephalopathy. It's a very generic thing. So I guess what I'm saying is that the quest for a specific cause for a specific vaccine is a misguided quest. Because when you think about it, every illness, in order for it to be a self-sustaining illness, implies some degree of predisposition on the part of the patient. You can't have an illness without that. An illness, at least, that's going to sustain itself. So even if there's a massive stimulus, the person still has to receive it and elaborate it in their own way. So there's a fallacy there. Okay, well, I'm going to skip over the Hep B because I don't think we have the time to go into it. I'll just say this, that Hep B, the specific effect there that I thought of, just from my own case experience and from what I've read, are autoimmune phenomena. Inflammatory disease of various kinds of an autoimmune nature, such as thyroiditis. I have a case, for example, I was doing some work for a lawyer in town who was bringing some of these vaccine adverse event cases before the federal government. That's how I learned how stacked they were against the patient. And there was a young lab tech who had received one round of Hep B vaccine, and a year later they found that she had no antibodies to it in her serum, so they interpreted that as meaning that it didn't work. And she had a number of symptoms that were troublesome after that first series. So her new employer decided that she had to have a second series because she's a lab tech. She's handling needles and blood all the time. So after the second set, she became much more ill, chronically ill, developed chronic thyroiditis, and was severely disabled by it. And what that said to me was that our notion that immunity is identical to the antibody titer is completely wrong. I'm going to present some more cases to show you that in a little while. But on the contrary, something was happening inside of her body, and when she got that second series, it was exaggerated. So It's interesting, when the vaccine was first introduced, the doctors didn't like it. They thought, this is silly. What do we need this for? And I'm going to come back to that later. I don't really have time for that now. But all of the concerns that the doctors had when that vaccine came out have turned out to be exactly true. Here's a statement from the vaccine establishment, the Advisory Committee on Immunization Practices, which is stacked heavily with vaccine advocates, that says that the vaccine is completely safe. And in my experience, it's one of the worst vaccines that there is. It's one of the first ones that was genetically recombined. And in other words, it's no longer a quote-unquote live virus, and therefore everybody feels that it can't possibly do any harm because it's not alive. But it's one of the worst vaccines in my experience. Just in terms of the spread, the array of things that can happen from it. But here's the spread. Well, wait, no, not that. Here's some of the things that have been reported. All the way down the line. Cryoglobulinemia, vasculitis, thyroiditis, multiple sclerosis, optic neuritis, systemic lupus, Guillain-Barré syndrome, urticaria, erythema multiforme, ecchymosis, petechiae, thrombocytopenia, and SIDS. This stuff is all over the map. Okay, so now I just want to contrast that with my own clinical experience, which bears out exactly what I've been saying, which is that whatever the specific effect of a specific vaccine may be, what I've found in my practice particularly is a non-specific effect of the vaccination process itself, regardless of the specific nature of the vaccine, so that in the same child, 2 or more different vaccines will induce the same response, because it's peculiar to the child as well as, or even more than, the particular vaccine. So it's not a smoking gun at all. And in fact, what it does is it makes worse what's already there. So here's the simplest possible case. And this group of cases, I think, is common enough to be the rule rather than the exception. This is just bread and butter stuff. This is a girl of 18 whom I had seen for years as a small child. She was troubled for years with bedwetting and with OCD, obsessive compulsive ideation, which was pretty extreme. She was completely cured with a variety of remedies, at least to the extent that she led a normal life. She was not wetting the bed. She was doing fine in school. Everything was rosy until it was time for her to go to college. And the college required that she receive an MMR booster, which many colleges do. And her whole picture came back. She started wetting the bed. She began her obsessive compulsive ideation all over again, just like when she was 6. You can see him better? You want to leave it that way? Okay, that's fine with me. So I gave her one of the remedies that I had given her in the past, and it immediately cleared up. But I'm not showing you this case because of the treatment. I'm showing it because of the bringing on, the precipitation of something which was already there. That's the sort of ground level basic response to any vaccine. Here's another one that's very interesting. This is a baby of 15 months old with recurrent ear infections, one of the commonest things you can see in any pediatric practice. Soon after her first DPT, she got her first one. She got a raging fever of 103, and then after that, all of the other episodes, she had no fever at all. And some of them were quite minor. She would have a little bit of an earache. She'd be a little bit fussy. Sometimes it would just be discovered routinely at a pediatric visit through just looking through the otoscope where the child was perfectly well and had no symptoms whatsoever. She'd had already, at the age of 15 months, she'd had 6 courses of antibiotics and developed diarrhea each time after each one of them. So I gave her a constitutional remedy, that is a remedy for the whole patient as I saw her at that particular time. And within a very short time, 2 weeks later, she developed an acute ear infection, just like the first one she had after the first DPT. She got 103 fever, and I gave her an acute remedy for that. The ear infection was over, and she never had another one after that. So, and I've followed this child for several years now, and she's completely well. It's not a problem. And what was interesting to me about this case was it shows that the function of the immune system is to teach, to learn how to respond acutely and vigorously to infection. So what worries me about these children with recurrent ear infections is that they don't get fevers. That it just sort of smolders, and then they give them the antibiotic and it gets a little better, and then the antibiotic wears off and then it comes back. So the child's never really that sick and they're never well. So I give her the remedy, and immediately, boom, she gets an acute ear infection, and then it's over. So that says to me that the function of the immune system is to develop an acute, vigorous response to infection. So I'm going to come back to that later. This is another case of ear infections in a child where she had exactly the same response to the DPT and the MMR, both. She'd had 4, at the age of 10 months, she'd had 4 ear infections, 4 rounds of antibiotics. The first DPT, her symptoms, she'd had a few symptoms even before that. They got worse, and then the ear infection came soon after with a high fever and a violent earache. And by the way, I've learned that a high fever and a violent earache is a good sign in a child because it means that they are responding vigorously and acutely. That's what they're supposed to do. It's only, you know, they can get stuck there, so you don't want to see that happen. That's where remedies are very helpful. But anyway, I gave her a bunch of remedies, and she did very well. She had fewer colds. She had no ear infections. She did have some mild symptoms with teething. And then her parents separated. And the father insisted on taking her for the MMR vaccine. So she developed another round of ear infections immediately after that. And once again, she responded acutely and vigorously. She did very well with remedies. And so it was a back and forth thing. Her mother would take her to me, and we would do remedies, and the kid would do beautifully. And then her father would take her to the pediatrician for vaccines and antibiotics and the whole bit, and she would get worse again. But, you know, now the kid's in college. I see her, and she's doing beautifully. She responds acutely and vigorously to whatever comes down the pike. And I don't want you to think that these nonspecific reactions are necessarily minor. They're not. And it doesn't matter that they have pre-existing conditions. They're still responding to the vaccine. Here's a kid who was 15 months old when I saw him. And he was already, he was a large baby, born to a diabetic mother and spent weeks on a respirator in the newborn intensive care for undeveloped lungs and cyanosis. So this was a problem kid right from the beginning. But after the first DPT, he developed swollen glands, became pale, and was restless for months. And then he was hospitalized for croup. He had a sunken chest and a high temperature. They put him on IV steroids. And the croupy cough persisted for months and months. So the mother decided she didn't want to give him the second DPT. She stalled it off for months rather. But finally he got better enough that she decided, okay, we'll do it. And immediately the whole thing came back. Temperature of 104, croup, swollen glands, etc. And when she brought the kid in, he looked subnormal. There was something about him. His tongue was hanging open like this, you know. And he was drooling and he was bashful. He was hiding behind his mom. That's not so uncommon. And I gave him, I actually tried a couple of remedies to no avail, and I finally gave him Brita carbonica, and within a couple of days the whole illness was over. He was fine. So a month later, the mother called back. She was ecstatic. It was in the dead of winter. He had no swollen glands, no croup, sleeping well. And that was the last I saw of him. And I guess in preparation for this book that I was writing, I called the mother up, and she said he's thriving. He's developing normally, like other children his age. In other words, he wasn't retarded. He wasn't continuing down that path. So again, I'm presenting this not to show you that homeopathy is wonderful, which it is, but the vaccine makes worse what's already there. It makes it chronic. It makes it more chronic. It makes it more relapsing. It makes it more intense. It reactivates what was there before. Any one of those. Here's another case of asthma. Same deal. This kid was on prednisone and steroid inhalers all year round, had had asthma for 2 years, 8 flare-ups, several needing oral prednisone, and lots of antibiotics as well. So after one series of remedies, he had cut his inhalers by 50%. His peak flows were much better. He was doing beautifully. He got through a cold without asthma for the first time. And he went on improving for another 6 months, with his peak flows were at record levels. And then in the fall, before entering kindergarten, he got his DPT booster, and the whole thing came back. Heavy bronchitis, intense allergy symptoms. The parents gave antibiotics, but then brought him in afterwards. We repeated the remedy, and he's done beautifully since. So again, you see the same pattern. Making worse what's already there. Well, in the interest of time, I'm not going to present the other cases that I have. They're just we just don't have enough time. But I think I made handouts of them so you can look at them. So I just want to make a few comments about. I'm actually running out of time here. Just a few comments about the difference between natural immunity. I mean, I want to understand how the vaccines work inside the body. Well, I'm just going to go through this very quickly. First of all, immunity is not just the presence or absence of antibodies. The antibodies are like the frosting on the cake. The cake is a massive outpouring of the whole immune system, so that when we get the measles, for example, which is a very good illustration, the disease we call the measles is essentially the successful attempt of the organism, of the immune system, to expel the virus from the blood. And so the antibodies are produced and are left over afterwards as a kind of a memory, so that no matter how many epidemics of measles are raging around me, I'm not going to get it again if I've gone through it. And I remember going through it when I was 6. And, you know, it was a powerful illness. I was in bed for a whole week. But, you know, in those days, my mother could afford to stay home and nurse me through the measles. And it was kind of pleasant, actually. But, you know, I credit the good health that I enjoy today in no small measure to the fact that I was allowed to come down with and recover from an acute illness like that. That was, you might say, a graduation ceremony for my immune system. So that, and this is my point. See, there's specific immunity, which is, okay, I'm never going to get the measles again, that's for sure. But there's also a non-specific component, which is that my immune system has been primed to respond acutely and vigorously so that it's ready for whatever else is going to come down the pike in the future. This is huge. So measles had already evolved from a killer disease that would kill about 20% of the people who had been exposed to it for the first time to a normal disease of childhood as it was when I was a child. So that non-specific mechanisms were already in place so that when that infection came, I was ready for it. And it was, you know, it was an illness for sure. I remember it. But the net gain to myself and to the race of being allowed to recover from that was huge. So whereas the vaccine immunity is something very different. I would say it's counterfeit. You have no illness, you have no outpouring of the immune system, you have no non-specific effect like that. On the contrary, you have a virus element which is designed to remain inside the blood for long periods of time with no obvious way of getting rid of it. So that will continue to produce antibodies against it. So that means that we're in a position to produce antibodies against those cells that are harboring it, which means that we're setting ourselves up for autoimmune phenomena, basically. And so this is my sense, that what the vaccines do is they produce a chronic illness instead of an acute illness. So the reason we don't get the acute measles is that we have the chronic measles, that we're incapable of responding acutely, not only to the measles, but also to other stuff. And that's why we get we get recurrent ear infections, we get asthma, we get eczema. We get this whole spectrum of things that runs the gamut of pediatric practice. This is as common as ABC. So this is not such a great trade-off. And I'll just, say a couple of words about the adjuvants that I'm sure you're all into, particularly thimerosal. But with the vaccines that are not alive, the vaccines that involve non-alive antigens, you have to have extra agents added to the vaccine to keep it, to hold it inside the body, so that it will stay for a long, long period of time. So in other words, you're building in a chronic situation there. And these adjuvants are nasty. Aluminum, formaldehyde, mercury. Everybody talks about mercury these days because, the vaccine companies are scrambling to try to find some substitute for it. But the point is they have to have something, because they want it to stay in the body for long periods of time. Okay. So I just want to say a couple of things about a few different vaccines, taking them individually. I don't want to dwell on this because, again, in the interest of time, I just want to say a word about the Hib and the pneumococcus. those two vaccines are interesting because they're developed against organisms that are normally resident inside the human body. They're vaccines against our own normal flora. It's just that, you know, a certain type of Haemophilus influenza, type B, is sometimes associated with invasive disease, such as pneumonia or ear infections, or in some cases endocarditis and bad things, life-threatening things. But most of the time they're just there. They don't do anything bad, and in fact they do good things. They protect us from other organisms that are not resident inside the human body. So the idea of making war on them is not a good idea. And indeed, pediatricians have objected to them on that basis, and very properly, because what has happened is that we're chasing our tail. We develop a vaccine against the certain subtypes that have been known to produce invasive disease, so other subtypes appear. And that's exactly what has happened. The pneumococcus was originally developed as a vaccine for elderly people in nursing homes, but they found out that it didn't work. So they decided to recycle it because it's also the leading organism, one of the leading organisms in ear infections. About 25% of the cases you culture out pneumococcus. So they recycled it for little kids. So this is a very typical evolution. And the same is true with Haemophilus influenza. Haemophilus influenza is also one of the major organisms in otitis media. And the same would be true of strep A. I think that there is a vaccine in the pipeline for strep A, and I'm sure that one's coming in the not distant future. Because the point of all of this is that, as I said before, they never met a vaccine that they didn't like. If you have this mechanism where you can develop a vaccine against any identifiable pathogen of any kind, and you can't find specific effects of specific vaccines, and they're all good, then why not throw it in? Why not give it a try? There's no downside. Well, I'm not. This is a beautiful slide, but we just don't have time for it. The chickenpox vaccine. Now, that's a vaccine that Merck, Sharp, and Dome had developed 30 years ago, but they've never figured out how to market it. But it was in the Clinton years that they finally figured out how to market it, because they started doing cost-benefit analyses, and they found that parents couldn't afford to stay home and nurse their kids through the chickenpox. They had to go to work to earn money. So they calculated the amount of money that would be lost by their not going to work, and comparing it to the cost of giving the vaccine. And they developed this elaborate cost-benefit analysis that showed that vaccinating was one of the most cost-effective strategies that we have in medicine today. But I think a moment's reflection will show you that if you start factoring in all the ear infections and all the ADD and all the sinusitis and all the allergies and all of the nonspecific reactions that I've been describing, the equation looks very, very different. I think vaccination is one of the most expensive as well as dangerous strategies that we have. Rotavirus. Now, this is a really good example of what happens. Rotavirus is a virus that's associated with infectious diarrhea, just a regular old gastroenteritis, not that different from polio as far as that goes, as far as the diarrhea part. And it's rampant in Africa. Millions and millions of children die from this every year. But the Africans can't afford the $20 a dose. So, whereas the American population, in whom rotavirus is not at all dangerous, there are no deaths practically from this disease at all, we can afford it. So they decided to market it in the United States. And this is a wonderful editorial that was in the New England Journal of Medicine that says, when is too much too much? 100 preventable deaths per year are too many. And $500 million in direct charges to the healthcare system is too high. So this is vaccination zeal, that no death, no theoretically preventable death is acceptable when you have a vaccine that's available to deal with it, to prevent it. So that's the thinking. And then, of course, there's the flu vaccine. That's ideal because that one you have to give every year, at least once. And with the H1N1, maybe you can add on a second one if you're lucky. So, okay, well, I think that's enough of that. I've got exactly 5 minutes left. So I just want to say some general things. I was going to talk about anthrax and smallpox, but we don't have time. So again, vaccination as religion. If there's no nonspecific effect, no general effect of vaccination, then you can pile on as many as you like. It doesn't matter because you're only interested in the specific effect of a specific vaccine, and the side effects have been managed in such a way that you can't see them. So, because after all, it's not really a cause if it's just bringing on something that's already there. It's not a cause if the kid is just coming down with what his neighbors are also getting. So it doesn't, even the parent doesn't necessarily recognize it until the kid has been well for a period of months, and then suddenly after a booster, the whole thing comes back, and then the parent realizes that this is a connection. So, but on the other hand, if there is this nonspecific effect that I've been talking about, then the absolute number of vaccines becomes very important indeed. In fact, it becomes of critical importance. So I started counting them up. Now, this was in 2004. There were 22 different vaccination events in the life of every 2-year-old child if they went through the official schedule. The Hep B, the DPT, the Hib, the polio, the MMR, the chickenpox, the pneumococcus, the influenza, 22 shots in the first 2 years of life. And many of those were triple or double components of something. So that's a lot. And that's only the beginning. By the time you get to be 18 and you go to college, you get 25 more. So that's 47 vaccination events by the time you're 18. One flu yearly, Hep A recommended, DPT booster, polio booster, MMR booster, chickenpox booster, flu every year. So we've got... And you don't get off the hook when you're an adult either. That's another group that's being targeted. Even pregnant women have finally been gathered into the fold, so to speak. It was always thought that if you were pregnant, you were exempt because it was a danger to the baby. But now the idea is that you're helping the baby and the other children by protecting them against these diseases. So it's reckless. So the literature is full of these exhortations to vaccinate up to the hilt. Now let's target the adults. Now let's target the adolescents. No one is immune. Let nobody be left behind. And finally, the bottom line. That's what I wanted to emphasize, because that's the last-ditch argument. That's the argument that is always brought out. Ever since the Clinton years, that was sort of the high watermark of the zeal for vaccinating everybody against everything. And it was that cost-benefit analysis that was the exciting new insight that everybody had, that it was the most cost-effective strategy. Whereas what I have learned is that it's the least cost-effective strategy for precisely the reason of this non-specific effect that I've been describing, which is huge. It's so common as to be the rule rather than the exception. So I think we're doing our kids a big disservice by not letting them get sick, not letting them evolve through their acute illnesses so that their immune systems can develop properly. So I just want to end with this quote from the great microbiologist René Dubos. I'll just read it aloud. Faith in the magical power of drugs often blunts the critical senses. This was written in the 50s, and at times comes close to a mass hysteria involving scientists and laymen alike. Men want miracles as much today as in the past. If they do not join the newer cults, they satisfy this need by worshiping at the altar of modern science. This faith in the magical power of drugs is not new. It helped to give medicine the authority of a priesthood and to recreate the glamour of ancient mysteries. Thank you very much.